My talk is Rise of the Clinical UXer, Health Wars. Hopefully people are fans of Star Wars. If you're not, that's unfortunate. I am very much an unashamed fan of Star Wars. I wouldn't quite class myself as a Star Wars geek, but I do like watching Star Wars. Anyway, my talk. First thing that I like to explain whenever I give a talk is to please stay in touch. It's very powerful being connected with other people that are either working in your industry or even other industries. It's a great way for personal and professional development. So you can get in touch with me through various means: LinkedIn, Twitter, Facebook, and of course through email. Anyway, so the agenda is that I'm going to talk a little bit about myself, what some more details about what clinical UX is, understand more about where we need clinical UXers and why we need more clinicians in UX. So I started my career in healthcare by going to medical school. I was born and raised in East London and went to my local medical school, Barts in London, School of Medicine and Dentistry. I was 18 years old. It was a fun time. Fast forward 6 years, I then started working as a medical doctor in Yorkshire, which was quite a different environment to living in East London, if any of you know much about the geography of Great Britain. And I worked as a doctor for 3 years, but I was getting a bit frustrated with how many 12-hour shifts I had to work, living hundreds of miles away from family and friends down in London. And it's not really being able to be very creative in my day job. So I decided to look for pastures new, for a new sort of career. And I wanted to have a role that could use my creative interests, creative skills, as well as my love for healthcare and helping people. And so I started working at a hospital in London, specifically in the IT department. And soon into that role, I was learning more about UX and the opportunities that we could have in improving the design of technology through a design process, which I'll be explaining a bit more a bit later. And so I started to carve out a career as a user experience professional, and I've gained a master's degree now in human computer interaction. And so at the age of 28, which I'm not now, I'm still a bit older than that, I started developing my brand. I set up the Clinical UX Association, which I'll talk about a bit later, and my own company, Dr. Hyphen, which I provide digital health and clinical UX consultancy services through. So I've mentioned clinical UX a few times now. What actually is clinical UX? So to better understand clinical UX, first we need to understand what actually UX is. So I would hope that you already know that it's short for user experience. The user experience, for me, as my definition is, it's about the experiences people have when interacting with the designed world. So anything that has been made by human beings, not something that's just there, that naturally exists. So I see that healthcare UX is a subset of UX. So healthcare user experience would be about the experiences people have when interacting with healthcare technology and services. Now, clinical UX is even more niche side of healthcare UX, where it's about the experiences that clinicians have when interacting with healthcare technology and services. Now, the reason why I focus primarily a lot of my work in clinical UX is because there's lots of people that are already doing a lot of great work, creating wearable technology or symptom trackers, or something that can help individuals, the general public, improve their health. But what is often quite neglected is software solutions that are aimed at clinicians working in the hospital and general practice services for them to use to improve healthcare. Their technology is very expensive, very clunky, very frustrating. I'm speaking from personal experience as a doctor, as well as a specialist designing those solutions. So that's where I focus most of my time, although a lot of people are working in this space in healthcare UX. Anyway, so experiences involve emotions, skills, and knowledge gained from an interaction. So hopefully you are in a good mood hearing me give my talk. I'm exercising the skills of presenting and public speaking, and there's a knowledge transfer based on what I already know that I'm passing on to you as a listener, but also knowledge that you may already have or knowledge that I'm giving to you in a new way. Now, interactions can be measured for their usability, accessibility, and pleasure. And we're going to go through these one by one just to make sure you're really clear on what I mean by that. So usability is about the ease of use and learnability of anything that has been designed. So for example, a remote control that's used for a TV, it doesn't matter what country you're in, you should know how to turn on a television, change the channels, be able to increase the volume. You may not have a clue what's being said if it's in a language that you're not familiar with, but actually performing basic functions with the TV should be easy. Now, accessibility relates to people being capable of interacting with a product or service, regardless of perceived inabilities or challenges. So as the examples I provide here, physical disability, age, or language. It's very common that there's a perception that the elderly may not be able to use smartphone devices. But if they've got eyes and they've got working fingers, actually what's stopping them from being able to use a smartphone, theoretically? Now, the last area, which I find is the most neglected part of user experience in healthcare, is pleasure, and it correlates with happiness in experience. Now, it's key in building trust, developing loyalty, and ensuring repeated use with a product or service. And when you have a deficit in either usability, accessibility, or pleasure, you're going to have a poorer user experience. Now, the double diamond design process is a process that I follow when I'm looking at designing a healthcare technology or service. Now, I have to give credit to the Design Council here in the UK, which is a company that specifically looks at improving the design of solutions, be them technology or services. And they came up with this process. I think it's really, really wonderful way of explaining how we go through a design process as UX designers. So you begin with an input, which is the problem situation. Could be anything. Say we want to make a healthcare app which can tell you when you are sick and what you should do next. So the first stage is a discovery phase. You're going to go through a process of trying to understand as much information about this problem situation through a number of research methods, asking loads of questions, speaking to people, reading articles or books, observing people, before you start defining and understanding the actual problem. Now, this process is a cycle and you can go backwards, but hopefully the end goal will be reached, which is identifying the right problem or problems. You then go through an ideation phase where you develop a variety of different ideas, thinking of all potential solutions to these problems that have been identified before delivering and creating the final solution that will solve these problems. And this process, again, is a cycle. You can go backwards, but the output should be the actual solutions that solve the problems from the input. But this whole process, this whole cycle can go backwards as well. So you don't have to feel that when you've created a solution, you're not allowed to actually do more research and more understanding of the problem or even coming up with new solutions. It should be something that you're doing. And that process of going back and coming up with new ideas all the time and backing it up with more research is, in effect, the iterative design process. So the double diamond design process with patients in mind is the same thing. If you're looking after a patient, you have a patient that's unwell, and the whole process is to gather information, to get a diagnosis, to then start treatment and give them a final diagnosis if the treatment guides you towards some other problems that they may have. But depending on what's going on, you may not even need to start treatment. So that's the only thing that's a bit different when dealing with patients that I've observed. Oops, that's an additional slide. Ignore that. So where do we need clinical UXers? So we need to have people that understand about UX that is going to be solving problems for clinicians and patients in all kinds of areas. And these main areas include healthcare centers, targeted groups, the general public, and special situations. For healthcare centers, this could be hospitals, community centers, or specialist centers for very specialized treatment services, and all kinds of end users, including clinicians, doctors, nurses, physiotherapists, non-clinicians who could be the managers or academics or legal team. Those are people using solutions that are going to impact the lives of the patients, their carers, and their friends or relatives. And the targeted groups, as shown here, could be the chronically ill, people of a particular age or gender or race. And again, the locations that these targeted groups can be found are vast. The general public is even more broader. Could be anybody with any problem. Could be that they're sick or when they're actually well. And the location again could be anywhere. And in the specialist situations, as I put here, examples are astronauts, deep sea divers, and miners, who are all going to have very unique, very special health needs that need to be addressed. And again, where they're going to be based is up in space, deep underground, or under the sea. Now, when we think about solutions, these again are very, very vast. So in healthcare centers, the common solution that's going to be used is some sort of record keeping system or the electronic patient record, or a solution that can support the clinicians in making a diagnosis. For targeted groups, it can include apps that make it clear the care pathways that are needed to treat these patients, or digital tools for screening for diseases. For the general public, there's wearable technology or triage technology, where just a simple app can tell you what you should do next with the symptoms you have. But the special situations are going to be even more unique, as shown from the examples there of a spacesuit, a diving suit, or mining suit that deals with the very unique health needs and functionalities that these people would have. So, why we need more clinicians in UX? So I'm a clinician, and I would be worried if me or any of my clinical colleagues didn't actually understand healthcare. But it's a fundamental area that we should, by definition, be very, very good at understanding. Now, because clinicians know healthcare, they're going to be able to provide a lot of insight in the problem situations that can be faced in healthcare. But there's a few other areas. Let's discuss these one by one. So the second area then is clinicians understand user-centered design. Now, user-centered design is a design philosophy where the end user's needs, wants, and limitations are focused at all stages within the design process and development lifecycle. So you're going to be keeping in mind in that double diamond design process, when you're doing your research and understanding the problem, to coming up with ideas and creating the final solution, you want to keep in mind the end user's needs, wants, and limitations as you go through those processes. Now, this is the same as patient-centered care, which doctors and other clinicians understand, which is a medical philosophy where the patient's needs, wants, and limitations are focused at all stages of their care. Now, diagnosing is like designing. Now, I've already showed you the double diamond design process, but looking back more specifically at what goes on with patients, say a patient comes in with chest pain. They say, doctor, I've got this chest pain. You ask for a history, and they're going to explain, well, actually, it started in the morning. As soon as I woke up, it woke me out of my sleep, and it goes down into my left arm, which, as any doctors or anybody that knows about healthcare would think, this could mean a heart attack. But under doing an examination, you notice that there's actually pain more in just around their stomach area when you press down, which may not mean a heart attack, could just mean indigestion. But you do some investigations like a chest x-ray, maybe take some blood tests, which gives you the final diagnosis that actually this isn't something sinister or something to really worry about. You offer some treatment, and let's do a checkup to make sure that they've responded to their treatment appropriately. And this process is a cycle, but you can go backwards. But as suggested with the design process, you're going to have a request, such as I want to sell products online, where the requirement for the business is that I want to sell products everywhere around the world in every currency. And then the users of that solution may say, well, I want to buy any product, which, if this doesn't already sound familiar, is a bit like the user case for Amazon. Then you go through an iterative design process, coming up with ideas of how this solution would look like before providing a final solution. And then you produce it and evaluate it to make sure that it satisfies the needs of the first request and the requirements and what's been gathered from user research. And this process is a cycle, and you can go backwards. So clinicians make for great champions, and champions are really, really important. You know, there's a difference between knowing and understanding. Knowledge is facts, information, and skills acquired through experience and education, whereas understanding is the application of knowledge for higher thought processes and performing tasks. Now, it's all well and good that you can have a lot of IT professionals that are working on a project who have knowledge of healthcare, but they don't have understanding. It's important to get the doctors and other healthcare professionals who really understand healthcare to be involved, because they will be able to tell you what are the areas you should be focusing on, or the areas that actually you focus too much on. just helps you direct your decision making in the whole design process. Now we can see these two babies here. On first glance, you may think that they're friends or they're acquaintances. They actually get along, but looks can be deceiving. We won't ever really know what's happened to this child, but it's important to understand that you don't always know as someone who hasn't worked in an environment who you can work with, who you can get along with, who's going to be supporting what you're doing, who could be against you. And this is where the clinicians as champions can help, because it's not always the most senior people in an organization that will have the power and the influence to drive change when you're introducing a new digital solution. It could be the people at the front line who may not seem like they've got much power, but actually, if given the opportunity, could do a lot of great things. So it's really important to get the clinicians on board, because they can be really, really helpful in implementing solutions, but also getting the insights from the frontline staff. Now, clinicians are more than just doctors. A few years back, I remember creating a Facebook group called More Than a Doctor, which was a place for doctors to talk about, what is it about their lives that makes them more than just doctors? And they've got all kinds of different skills. And this video actually explains that in a bit more detail. So as you can see, the equation is prove that the variable I is greater than the constant doctor. So how can we mathematically prove that an individual is more than just a doctor if an individual is a doctor? So this kind of describes me, that I'm a musician, I'm an artist, I'm an amateur chef. I do enjoy cooking for my wife and for friends and guests. But the fact that I'm a musician and an artist and an amateur chef means that I equals musician and artist and amateur chef. But of course, a doctor is someone who is specifically designed to use their medical degree and experiences to treat the sick. So if I'm a doctor, but a doctor is not a musician and is not an artist and is not an amateur chef, therefore I must be greater than a doctor. If we just speed this up a little bit because I'm conscious of time. So let's keep going then. I believe that optimized UX is vital for the future of healthcare, and many people are needed to optimize UX in healthcare. So how can you help? How can you be involved? Well, as I mentioned before, the Clinical UX Association is a global community of clinicians, UX and IT professionals, all passionate about improving the use of technology in healthcare and improving the access of healthcare for all. So it's a not-for-profit, it's all voluntary. We do meetups in different countries in the UK, South Africa, South America, and East Coast of the United States. So hopefully you've enjoyed my short talk. It definitely is an exhaustive explanation of what all the work that I do in UX and my other colleagues working in healthcare UX. But hopefully it's giving you some insight and giving you a bit more understanding of why I believe we should get more clinicians involved. So hopefully you have some questions for me.
Hey, thanks, Phil. Very interesting. And yes, we have already like a comment or a question to start with.
Yes, from
coming to, like, yeah, Julian writes, like, in my experience, doctors are not very open to changes like digital health. How do we convince them with UX?
Yeah, so I think it definitely ties into one of my points I made about having doctors as champions. So
Yeah.
Very humbled, but appreciative of the fact that because I'm also a doctor as well as a UX professional, the clinicians are very, very much on my side. Because part of the first way I open discussions with these doctors and other healthcare professionals is having a bit of a moan about what it's like to work as a doctor. And so because they know that I know the problems that they're facing, they're going to be a lot more open to being a part of research, be it right at the beginning where we're just exploring the problem situation, or when we've got ideas for a solution and we want to get their insights. So
Sure.
It definitely helps by being a clinician. But the other thing as well is just that if you explain to the clinicians why you're doing what you're doing and try to get from them as much information about what they would want as an improvement to their lives. As soon as they can quickly understand that you're going to be bringing something that's going to improve their life, they will be very open to change. What doctors don't like is another IT project that's going to fail, because that's what they've become used to. So you need to prove to them very quickly in the way you introduce yourself, the way you interact with them, that actually you're going to bring about change.
Sure, absolutely, absolutely agree. And now just Adrena wrote, at what stage of tech procurement deployment do you get involved?
So it's very frustrating at times that often I get called on to a project when the solution's already been produced, but they still want to improve it. Now, this is very, very difficult because it's kind of like trying to turn, you know, fried egg into scrambled egg. You know, the egg's already been cooked. How am I supposed to turn it into a new type of egg? Or even worse, you want to try and turn a fried egg into mayonnaise, which is made from eggs, but it's completely different. So this is one of the problems, is that by having to be introduced later into the project, it's harder to bring about much success. But there are times, particularly with startups, where they've got an idea for a solution and they've started to code it, but because they have not deployed it, there's a lot more opportunity to make changes. So I prefer to work on projects in that way because I'll have more impact, but it's not always possible, unfortunately.
Sure. And I think, Michael, this is the question is connected to the discussion we are having now. Like, how many projects did you already completed? Which ones, success stories? This is, I think, you mentioned it before. If you are like involved at the beginning, do you have some project to share, like as best practice, how it should work? Like, are they only startups or like other projects?
It's all kinds of projects, really. So one of the projects that actually I enjoyed the most, it was really, really simple intervention in hindsight, but it had huge impact. So this was when I was working at Guy's St. Thomas's very early on in my career. And they, in the children's department, Evelina Children's Hospital, they wanted to speed up the way that they got information from the outpatients clinic into the electronic health record solution. So specifically, there's an outpatient's outcome form. So a simple A4 sheet of paper with patient information, but the most important detail on it was what's going to happen after this outpatient's appointment. So is the patient going to be discharged back to the GP? Are they going to have investigations, some treatment, or are they treated? Are they fine? Now, because it was on paper, as you can imagine, the paper can get lost, it can be completed incorrectly, you can get errors on it, so on and so forth. So all I needed to do was understand the situation, which was they wanted to have an electronic version, but for some reason they thought that the managers wanted to print off the form when it was completed electronically so that the administrators could then manually type it in. And I said, well, why don't we keep the whole process electronic?
Sure.
By doing that, we managed to actually save the department a few hundred sheets of paper being used every single week. And those sheets of paper actually had to be saved. So every month, you know, maybe about 1,000 sheets of paper have been saved, which we can even estimate to be about 12 to 15,000 sheets of paper a year. So that was quite a simple project, but it was nice being able to just understand the simple problem that these people had from the get-go and look at their processes and see how can we go paperless in a way that's going to be easy to implement and stress-free. And it doesn't even mean that you have to make a new app to do something like that or do something really complicated. It's all about understanding what's the problem and what are the best solutions for it.
Sure. Yeah, I think, and I can connect now to another question. Like Sean is writing, agree, UX is important, but the system need to change. How can your initiative help there? Data access, patient-centric, new business models?
I think part of the change, even if we, you know, not to get too political or religious or anything, but when you look at massive changes in the world, it comes from either an individual to begin with, and then an organization, a following of people, and then a strong message, a strong vision for the future. And so I think a key part of this is actually having communities of people that have a shared vision for the future that is better than what exists now, who are all working towards the same goal and all saying the same thing. And I think we haven't got enough people speaking as a group, as a collective, about the importance of user experience and design in healthcare. And until we have an organization and a presence that's big enough that the politicians take notice of and the people running the hospitals, we won't really get the change that we deserve.
Sure. Yeah, and I think this is exactly what you're aiming to, with organizing, speaking, working on these projects, and even, which I think is great, being a doctor and now being in the healthcare UX engaged. This is great, and I hope there are much more than from you, no? Or how many are there, like doctors, like you are?
Like me, it's exceptionally rare, to be honest. Just saying thank you as well to Sean. Thank you. I appreciate all the well wishes for what I'm doing. It's not easy, the work I do, especially considering as the answer to your question, Thomas. There's very few of us. I only know of about 4 other doctors in the world that have
Yeah.
gained a medical qualification, work as a doctor regularly, but also have expertise in user experience. So 2 of them I know in the UK, and another 2 that I know in the United States.
Okay.
Probably are more doctors that do a lot of design work, but they wouldn't specialize in user experience. Actually, the understanding of best practice on designing these solutions, they may focus more on, say, visual design or just creating a nice product, but more from an entrepreneur point of view rather than as a designer.
Sure. Yeah, I think then it's like more a call to action, like join the movement, the initiative you are having, making more doctors getting in the direction, supporting you, making a movement out of this, which I believe is necessary as well, especially, yes, always talking about doctors don't want to change and so on, but we see here a very good example
Mhm.
how it can be done.
Yes,
Absolutely.
it can definitely be done. It's not an easy transition. There isn't a lot of support for doctors to leave healthcare. Likewise, there isn't a lot of opportunities that are very clear and obvious. So there are many opportunities to go into design and healthcare UX, but they're not so obvious to doctors, because when you train to be a doctor, you're kind of convinced that that's it until you're retired. That's the only job you're ever going to have.
Sure. Yeah, I think that was a very good closing for already this third edition. Was a great pleasure having you with us, Gilles, and wishing you all the best for the future and stay in contact. Looking forward your future work and projects, and perhaps you will have you again with an update on another success story on the next edition in the future.
No, that sounds
So,
great.
yeah, I think that's it already. The time was running very fast, 90 minutes of knowledge gain, free knowledge gain about innovation in healthcare. Thank you so much for all joining us. And looking forward for our next edition will be November 29 already. So applications are open. Please register if you want to join. As Gilles did, sharing great stories and looking forward for the next edition. And thanks for your time. Wishing you a great time. And Gilles, for you as well. Again, best luck and all the best.
Thank you. It's been a pleasure.
Yeah, thanks. Okay, bye guys.
Bye bye.